how to avoid preterm labour. So while you can't actually eliminate all the risks in pregnancy, there are some actions that you can take with your healthcare team to reduce the chance of you going into preterm labour. So here are some practical steps. Early and regular antenatal care. So it's really important that once you find out you're pregnant, book your pregnancy early so that you can be offered all the necessary screening and appointments that you need. Share your full medical and obstetric history with your midwives and your doctors. Any past preterm births that you've had, any previous surgeries, any miscarriages that you've had as well, cervical procedures also. Get as much detail on all of your history as you can so that you can be prepared to share that with the team. Attend all appointments and all scheduled antenatal appointments, any screening, all the scans that you are offered, including your cervical length scans if you are at increased risk of preterm labour and birth. Any swabs for infections as well, any urine tests, make sure that you engage in getting all of that done. Lifestyle and health optimization. So don't smoke or get help with quitting smoking and avoid any exposure to secondhand smoke as well. Maintain a healthy weight in pregnancy as well and ensure that you have a good diet and good nutrition to support your pregnancy. Keep physically active if it is safe to do so. Moderate to physical activity generally helps during pregnancy and also helps you to avoid weight gain, and it can also help to reduce the risk of hypertension and diabetes as well. Treat and prevent any infections that are likely to occur. So making sure that you report any signs of infection, any urinary symptoms, any discharge that's unusual, slightly heavier, or any unexplained vaginal symptoms as well. Treat them early. And if you do notice any changes in your discharge or any signs of infections, go and get checked as early as you can to give yourself the best chance to treat or clear any infections. Ensure that you do have all your recommended vaccinations. So if that's coming into winter season, flu vaccination, if you're offered COVID vaccination, your immunizations as well to support your baby, make sure that you are engaging in all of that. And maintain good food hygiene, hand washing, and avoid any risky tasks as well. If you have a short cervix or a history of a preterm birth, you may be offered a cervical cerclage or a stitch, or even progesterone pessaries to help support in keeping the pregnancy to get to the end. Emotional well-being and stress management is also really important in reducing your risk of preterm labour and birth. So stress management, managing your anxiety, and getting support with any social difficulties that you may be facing. So housing, financial difficulties, or domestic abuse as well, because these can increase those risks. So talk with your midwife or your doctors and see what support and help is available to you.